After looking at the chemical concept, we will now move on to take a look at the implications of antibiotics to society. Firstly, what are antibiotics? Antibiotics are substances that inhibits the growth and replication of a bacterium or kills it outright can be called an antibiotic. Antibiotics are a type of antimicrobial designed to target bacterial infections within or on the body. The picture below shows an antibiotic test plate. However, antibiotics are subtly different from the other main kinds of antimicrobials widely used today. Antiseptics and disinfectants are antimicrobials as well, as they are agents that kill microorganisms and stop the growth of it. Antiseptics are used to sterilize surfaces of living tissue when the risk of infection is high, such as during surgery. Disinfectants are non-selective antimicrobials, killing a wide range of microorganisms including bacteria. They are used on non-living surfaces, for example in hospitals. So, how does antibiotics work? Antibiotics are used to treat bacterial infections. Some are highly specialized and are only effective against certain bacteria. Others, known as broad-spectrum antibiotics, attack a wide range of bacteria, including ones that are beneficial to us. There are two main ways in which antibiotics target bacteria. They either prevent the reproduction of bacteria, or they kill the bacteria, for example by stopping the mechanism responsible for building their cell walls. After getting a rough idea of what are antibiotics and how it works, we will now be taking a closer look on penicillin. This is the general structure of penicillin. As seen in the diagram, the basic chemical structure of all penicillins consists of a beta-lactam ring, a thiazolidine ring, and a side chain. The antibacterial activity of the penicillins lies within the beta-lactam ring. Any alteration in this ring structure forms penicilloic acid and the antibacterial activity of the compound is lost. The side chain varies with each penicillin compound and generally determines the spectrum of activity, as well as the pharmacokinetic properties of the compound. There are many types of penicillin. Penicillin G, also known as benzyl penicillin, is the most active and is the only natural penicillin used clinically. The types of functional groups found in penicillin G are two amide groups, a carboxylate ion, and a thiether. Functional groups are seen at 1, a thiether. At 4,7,8, an amide functional group. At 11,12,13, a carboxylate ion, and at 14,15, another amide functional group. Now, we'll discuss on the benefits of penicillin. The main benefits of penicillin is that it inhibits growth bacteria and kills it. This can be done by preventing the formation of new cell walls. Because of this method, bacteria can be killed without harming the rest of the human cells. Here is a list of bacteria infection penicillin can prevent. 1. Infections with group A streptococcal bacteria. 2. Recurrence of rheumatic fever. 3. Infections caused by pneumococcal bacteria in people who have had their spleen removed, or who have sickle cell disease. Here are some common use of penicillin. Mouth infections, including dental abscesses, tonsillitis or streptococcal throat infections, middle ear infections, scarlet fever, skin and soft tissue infections, such as cellulitis or erysipelas. And finally, infections that were initially treated with injections of benzyl penicillin. Moving on to the limitations of penicillin. The effectiveness is reduced after prolonged use and increased dosage due to bacteria developing resistance against drug. The limitation is in line with other types of antibiotics. Next, penicillin has prominent side effects and not recommended for patients with penicillin allergy. Side effects include commonplace adverse reactions like diarrhea, nausea to serious illnesses like lightheadedness and fever. One who is allergic to a single variant of penicillin should avoid the entire medication group. Signs of allergy include hives, swelling of mouth, throat and dizziness.